Hello, I'm Kathy Chester, and this is Move It or Lose It, a podcast about all things that move the mind, body, spirit, and soul. Okay, hello. Welcome to another episode of Move It or Lose It, our podcast. Welcome to March, all of my MS warriors. And today I'm so excited for our first guest in March to be Dr. Brandon Bieber, somebody that I actually joined Twitter just to find. So Dr. Bieber, welcome to our show. We're so excited to have you today.
Thank you for having me, Kathy.
Thank you. So you've got quite a resume and you've done quite a bit for, I'm going to put you at, I don't even want to guess your age because it'll just age me. So you grew up in Los Angeles, correct?
That's right. Yes.
That must have been horrific. I'm in Michigan. It's freezing. So
in terms of weather, we have you beat for sure.
Yes,
in terms of pollution, it may be a different story.
This is true. Okay. And so your interest in health and science, you've always had that interest. So you were just, I imagine you, my little guy, my youngest, has always been into science and stuff like that. So that caught your interest when you were just a little boy?
I think from a very young age, maybe I originally wanted to be a teacher, but when I was around 16, I think I knew I wanted to go into medicine.
Okay, that's awesome. And then you went to a really easy to get into school like Berkeley. So you went there.
Yes,
Simple,
I did,
easy.
yes.
And then with that, you got your bachelor's degree in not going to say that, and cellular biology.
Let's just say biology.
Okay. With the emphasis on genetics, which I find that to be really interesting development. You attended medical school in Philadelphia after that. So do you want to talk about that? Why Philadelphia?
Well, I went to Drexel University College of Medicine, and they have a really neat program, the program for integrated learning. And it's just sort of a way to learn medicine in small groups where we cooperate with each other. So that's really what attracted me. And I certainly got a taste of the cold and snow, although not quite as bad as Michigan.
Yeah, true. Although like you, I have a lot of my clients are in Canada, things like that. So we don't get quite that much, but yes, we get our fair share. So after you did that, you came then back to Berkeley, correct?
Back to Los Angeles to do my training.
Yes. And so from there, go ahead and tell us from there what drew you to multiple sclerosis and what brought you to be a neurologist. How did that path kind of come?
Well, I was only one step ahead. I had no idea what I wanted to specialize in when I went to medical school. The reality is, most entering medical students don't really have a good concept of the different specialties and what they do, even except for maybe whom they shadowed with. But I was really interested in neurology during the third year. And so that's kind of how I got into it. Neurology is a very broad field. I kind of enjoy in what I do now that I treat people with chronic diseases, mostly in the outpatient setting, and I really get to know them and their families over time. And I just enjoy that style of practice in medicine. In neurology, we also have stroke and brain hemorrhages and trauma, but, I like chronic care and to build relationships with people. And multiple sclerosis and immunology is just a fascinating field. There's so much research. There's so many advances. As you've experienced, with your own, course of having MS, there are just so many changes even within the last 10 years.
Right.
I had a really great mentor. Her name is Dr. Annetta Langer-Gould, who is involved in a lot of MS research, and she just has a sort of tremendous passion for the field. And she's one of the people who first got me into it.
Yeah. I've been trying to read your book. I'm dying for you to get it on Audible, because I am one of those lucky patients with optic neuritis, but with pain. So I have a hard time reading. So I'm like 2 pages at a time. So I'm hoping that it comes on Audible so I can hear it and read it more than a page every.
I was planning that. I was actually trying to get a narrator some time ago. I haven't thought about that in a little bit, but you just piqued my interest again.
Yeah. Well, just because I know there's so many of us with eye issues. And so often I think of, I think about the author, and, not to add more to your plate, but it is so refreshing for us when we lose the ability to read. For me, I was always a lover of books. And when that was taken from me, there's nothing more frustrating than thinking you're getting the author, which, a lot of times that doesn't happen, but it's a voice that would never sound like the author. And you're like, I can't do this. So, yeah, I mean, in your spare time, if you could just read it out loud, and that'd be awesome. Thank you.
In my spare time, I don't have the voice for 20 hours of reading. You can see I'm sipping water during the interviews because I lose my voice throughout the day. So I was hoping to get someone else to do it, but I suppose I could do it myself.
It would be just coming from my side of the world in the MS eyesight world. It is, it's great to have that. And I gave Tyler Campbell kind of a push that way too, and he's doing that. So, but so I wanted to talk to you about, so when you were going through all this, where I'm jumping a little bit ahead, where in the world did the idea of you doing YouTube come to play? When did you ever decide that, think of that when you were a kid? I'm going to be a YouTube star. Was that?
Well, I'm from the generation where social media was considered to be bad. We were afraid you're going to ruin your career. You say one wrong thing or one inappropriate comment and it's there forever. And, I sort of originally was on Twitter, and I found it to be very useful. Like I was learning a lot of information about MS, seeing new research right when it comes out, seeing the commentary of experts. So I just kind of appreciated like the educational value of social media. And I saw, Dr. Aaron Boster's videos on YouTube, and I liked them. And I made one video, and he sort of encouraged me to do more. And I sort of got into the hobby, and I've been doing it for, 3 years or so now. And I really enjoy it and have no sense that I'm going to stop anytime soon.
And like I said to you before, what I do really like about yours is I do like that you have very, just very intriguing guests on there that I think is just where, like you said, it's easy for me to pop on if I want to do something and quick, it's done. But, to coordinate everything and to get to have, that guest on, but very much appreciated. And I can't tell you how many times I've shared that with another MS patient that I work with or a friend and have said, like, have you heard this? And that you were flying all over. If you get, it's in the MS world, if Matthew Embry sends out the alarm that you had said something when it was the Epstein-Barr issue. And once that came out and you spoke on that, the whole MS world was alerted that you had spoke about it. So we all watched that. So that was very interesting, and we'll get to that. But
that's very big news for sure.
Yeah, it is definitely. And very exciting for us. So I would ask you, when you started to do the YouTube, which I love that. I think for us now, it's, we're such a visual, right? And so like for my podcast, I realized as I planned it through the years, it would never be something that would just be audio. I realized that it would have to go up on YouTube because there's so many people that want to see as well as hear. So I like that you do the YouTube. How do you find it with your patients to coordinate seeing your patients and getting the amount of videos that you want to get out?
Well, I try not to spend, too much time doing social media or anything. I mean, I'm a clinician, I'm a full-time clinician. I see patients 5 days a week. I do a lot other than MS. I treat general neurological diseases, stroke, Parkinson's disease, migraine. I do Botox, so I try not to spend too much time doing it. But, on Wednesday, I have a little time in the afternoon, like when we're filming this now. And so I usually do just one video a week.
Yeah.
And, the quality of content varies. I mean, sometimes it's just a screen record of an article that I can do in 10 minutes. And sometimes it requires a decent amount of preparation. To do that Epstein-Barr virus video, I did a lot of research on that.
Yeah, absolutely. And it showed. And what would you say then, just a quick question kind of off that, when you've got so many of our MS warriors and different autoimmune warriors, and they want to go into something like this. And I think a lot of them fear the content that, like, what if I don't have like this big guest or this huge amount of content? I often say to them, it's okay, to put something out that your thought for the day. And it doesn't have to be so, you don't have to overthink it and, make it so analytical. Then it kind of takes away from your personality. So what would you say to that?
Yeah, I think my ability to predict what people want to see is not very good in general. I had some videos I thought were really well done and was proud of, and people didn't seem to like them. And I had some other very
Okay.
simple videos that people appreciated. And that's kind of the beauty of social media as opposed to
Right.
traditional media, that there's such a low barrier of entry that you can just try
Right.
something and see what
Right.
works.
For
And,
sure.
my goal is not necessarily to maximize views. I kind of try
Right.
to make the videos that I'm interested in, and hopefully other people like them.
Right. Definitely. Well, I have definitely found them to be very, very fascinating, and I really have loved them. Well, without going into a little bit further now, I do want to talk to you about the Epstein-Barr video that you did. So I want to talk to you about how is this going to, for those of you who didn't see it, please go back and we'll put it on the bottom of our show notes and watch the video if you've not watched it, because it is, you did such an incredible job on it. Help us understand in a smaller, so that they will go watch your video. How does this excite us, and what does this mean for multiple sclerosis?
Well, to give a little background, EBV, or Epstein-Barr virus, is the virus that causes mononucleosis glandular fever. About 95% of adults are infected with it, even if they didn't have any symptoms. Some people do have symptoms, like they get very sleepy or have swollen lymph nodes, hence glandular fever. And usually people get the infection when they're a young child, school-age child, or as a teenager. And that's why they sometimes call it the kissing disease, because that's kind of when you start acquiring diseases transferred by saliva. But it turns out that the virus is associated with MS. Now, obviously, the overwhelming majority of people who get EBV don't get MS, but virtually 100% of people who have MS as adults have evidence in their blood. They have antibodies against the virus, suggesting they've been exposed in the past. It turns out when you get infected with EBV, it stays in your body for life, even though it doesn't really cause symptoms because your immune system controls it. And there's evidence that the virus can hide out in B lymphocytes, even though it originally infects the epithelial cells, like in the tonsils. It can get in the B cells, the cells that make antibodies and present antigens. And of course, those are the cells that are targeted by certain MS drugs like rituximab, Kesimpta, and Ocrevus. And it's well known that these cells are involved in the pathogenesis of MS. And one of the theories is that these drugs may help MS in part by clearing out Epstein-Barr virus, in addition to their immunosuppressive effects. But anyway, it's been well known, this association between EBV and MS, but this study done at Harvard on the US military found an even stronger evidence for an association. One thing is that among 801 adults who had MS, 800 tested positive for antibodies, so virtually 100%. And hey, the diagnosis of MS can be a little bit subjective. You can get a wrong diagnosis. So who knows what happened in that one case? Another thing that was interesting is that some people originally tested negative for Epstein-Barr virus, but went on to develop MS anyway. And in all but one of those individuals, 34 out of 35, they tested positive for Epstein-Barr virus prior to getting multiple sclerosis.
Wow.
Suggesting almost it has to occur beforehand. And they looked at this with various other viruses, cytomegaloviruses, and none of them had this phenomenon, really just Epstein-Barr virus.
Yeah.
Another incredible thing is that there is a biomarker of injury to the central nervous system that has some utility in MS, which is serum neurofilament light chain. It's a blood test that measures injury to the brain and spinal cord. It's very nonspecific. It varies a lot from person to person, but on the average, it's associated with MS and associated with progression and relapses in MS. And they found that people had an elevation of serum neurofilament prior to diagnosis of MS, which is very well known. In fact, it can be elevated 6 years prior to diagnosis of MS. But in this study, they found that the elevation of serum neurofilament occurred only after people tested positive for Epstein-Barr virus. So even the early physiologic marker of central nervous system injury, even without symptoms, occurs after Epstein-Barr virus. This really strongly suggests that Epstein-Barr virus is part of the cause of MS, not just some kind of epiphenomenon or some kind of association.
Right. How long do you think that? Because I remember asking, my son had Epstein-Barr and he has MS. And, which is always a 1% chance. I think we're still at that a parent giving it to a son. And what is it? I think 2% that I could give it to my daughter. And my oldest son was the one to get it. My aunt had it on the same side. I'm trying to remember my question now. So, what are the so the Epstein-Barr, my aunt had, my son had, I had Epstein-Barr along with I also had mononucleosis, but I also had I had spinal meningitis. So that was also something that that I had. So I do find it very interesting. How long do you believe? Why was this so in the dark? Why was this not discussed more often earlier? Why is this now such a hot topic?
Well, it has been discussed. I mean, the link was considered not definitive. It could be just a correlation. Professor Gavin Giovannoni, who's the writer of a famous multiple sclerosis blog in London, the Bart's in London Mouse Doctor blog, he's been talking about Epstein-Barr virus for years and years.
Right.
And, they were even trying to do studies on like antiretroviral drugs, which have activity against Epstein-Barr virus. These are kind of HIV drugs that also target Epstein-Barr virus. And so people have talked about it, but, it was unclear how to use this information. What exactly are we going to do about it? We don't have a treatment for Epstein-Barr virus. I mean, I don't test my patients to see if they have Epstein-Barr virus because it didn't really matter. Although now, or at least in the near future, it may start to matter because of the potential of therapeutics.
Okay. So you're thinking that they'll be tested, and then obviously the hope is vaccination, and then we can hopefully vaccinate early. When our kids, like I would, had it been years earlier, I would have wanted all of my kids vaccinated. So that's kind of the hope that we are moving towards.
Yeah, I mean, obviously, this is a long way away. Moderna, the company that makes the COVID-19 vaccine, they're doing a phase 1 trial on Epstein-Barr virus vaccine, just a phase 1 trial in people without MS. And, it's just a safety study just to make sure the vaccine doesn't cause some kind of terrible side effects. And, we're a long way away, but let's say they could prove that if you give this vaccine, you could prevent people from getting EBV. Maybe it could be given to people to prevent MS. And of course, the question is, are we going to give it to everyone? Are we going to give it to, only people who are higher risk of MS, like people with a family history? I'm not so sure. But in theory, we could prevent MS if we had a highly effective vaccine.
Yeah. Which is extremely exciting. So in your estimation, when you say, just to clarify for those of our listeners who don't know, like you're in phase 1 and then they think, okay, this should be available by next year. No, it takes longer than phase 1. So explain that as quickly as you can without it sounding, you know what I'm saying?
Well, sure. So there are preclinical studies like in animals, cell culture. Phase 1 are early safety studies, often done in people without the disease, just to make sure the drug is safe. Phase 2 studies are studies in the people with the condition. So it would be in people with multiple sclerosis or in, say, children of people with multiple sclerosis, looking for early signs of efficacy, but smaller studies that may not have the really power to demonstrate a clear difference. And then phase 3 studies are the large studies in people you're trying to target, where you're trying to prove the drug is effective and safe. And those are the studies you need for FDA approval or EMA approval.
Right. So we still got a little bit of ways, but the point is that we're finding new things and we're getting there. We're moving in the right direction. And I think, I know for us that it was very exciting to hear that, and that there are new things coming, and that even though, yes, I've heard of that, I didn't word it exactly the way I wanted to, but like you said, it wasn't something you go into the neurologist office and chat about. It wasn't, because there wasn't a reason to.
Well, you could now, there are clinical trials, for example, for the investigational drug ATA-188, which is an anti-Epstein-Barr virus T cell therapy. That is something that is an option in the clinical trial setting for people with progressive multiple sclerosis. And,
it's only for progressive MS, right?
Right now, the trial they're doing is in progressive MS, but I'm sure they're going to start a relapsing MS trial. Conflict of interest, I am like a sub investigator of that trial at my site, but I'm not directly involved, not getting paid and anything like that.
Okay. Good. I'll put that on there. You're doing good. So then, so the Epstein-Barr, anything that you want to add to that before we move on? Because I know it's a big topic and I don't want to rush through that.
Well, one other thing is antivirals. So one of the
Yes.
HIV medications, letonavir, also has some evidence against Epstein-Barr virus, at least in cell culture studies. Does it do anything for people with MS? We don't know, but it's a drug we could potentially study.
Right, right. So now how would that be given?
That's just a simple pill,
Okay.
and relatively low risk as far as I know.
Okay, great. That's really good. So I love that. I'm excited to hear your videos, and then I'll probably snag you again. We come up with new things with Epstein-Barr, and obviously a hot topic that we're talking about all over social media and all of our stuff is Epstein-Barr virus. So Dr. Bieber, the other thing I have with a lot of my listeners, and then once they knew that I had an opportunity with you, they were like, ask him this, ask him this. With the COVID, obviously, I know you've got to be exhausted answering these questions, but nevertheless, I have to ask them because we still have many that don't know the answer. With having COVID and now the boosters and still some not getting the vaccinations, of course, I'm on Ocrevus, like we talked about before we started. What are some of the biggest fears, and why are we still not seeing all of our autoimmune world going to get vaccinated?
Well, I guess it depends on how you look at it.
Should we take them?
You should definitely take them, particularly if you're immunosuppressed or otherwise higher risk. It depends on how you look at it. Within Kaiser Permanente, we have over 80% of eligible adults vaccinated against COVID-19. That's not too bad. It's a lot better than we do with the flu vaccine.
Right.
Although certainly, we have a lot of people who don't want the vaccine. I mean, I had the recent experience of a patient who was over 60 and immunosuppressed who didn't want the vaccine. And, I just try to counsel people based on the risks and benefits, as much as possible. Unfortunately, I have had quite a few patients, hospitalized or even who died of COVID-19.
Yeah.
It is looking better now, though. The rates of new infection are going down. But, if you haven't been vaccinated, and I can't really predict the future, certainly there could be another surge. My opinion is the benefits greatly outweigh the risk.
Yeah.
One possible exception is if you're like a low risk younger male between age 16 and 25 in particular, there is a small risk of pericarditis, myocarditis with the mRNA vaccines. So, if you're over 18, you could consider the Johnson & Johnson vaccine. And if you want to get the mRNA vaccines, you could consider the Pfizer vaccine, which seems to be a little bit safer. And also there's some evidence that spacing the vaccines out, like getting one dose and then waiting 3 months and getting the second dose instead of just 3 weeks, that seems to lower the risk.
Okay. Interesting. Well, those are all good things to know. And especially with, a lot of times like you are, I'll be with a client that's in a different country. So when all of the COVID stuff happened, I started to take my practice and started training via Zoom. So I could be in India somewhere. And then, wherever country they're in this like dark place. And I'm like, are you safe? Do you know where, can you get out somewhere? Have you seen a doctor? And so sometimes those are the more scary things for me, the patients that are just so afraid and have skipped their medications and have just still inside. And yes, this is all scary, but for goodness sakes, like make sure you're getting your medications and not making the problem much bigger so that we're strong enough to fight. For example, I did get COVID a few months ago, and I did very well on it. I got it. Of course, my family was terrified because of the Ocrevus, but I was able to get the antibody infusion, and I felt very strong. And within 4 days, I felt okay, and I feel good.
Yeah, I mean, what we found, in people with MS taking immunosuppressants is perhaps the larger factor is just overall health. Obviously you're a very fit person, you're a physical trainer, you probably don't have diabetes, hypertension, and that's huge. You probably decreased your risk just with lifestyle.
Right. And I would say that too, Dr. I know that you and I agree on that a lot. And being diagnosed, I don't want this to get into my story because this is about you. But I do agree with that. And learning, I was diagnosed so long ago, back before they ever said it was just rest, rest, rest. It just never sat well with me. I think being such an active person and being in so many sports, coaching sports, knowing so much about the body and being a trainer, it was like, well, my body will start to atrophy. And so thank you for the VHS tapes of the old couple that are on a stroll, but I think I'm going to find my way. So started with water aerobics and had fun with that. And then kept looking in the gym, like I'm getting in there, I'm getting in. And then I was given some great advice by a veteran, MS veteran, that said, try something you've not done so you can't compare it. So like if you were a famous baseball player, maybe I was, maybe I wasn't, but if that was your thing, then maybe don't go to that, go to something else so you can't compare what you used to be like. So probably not the first thing an MS person would think of, but I thought I'm going to take on running. So I took on running. And, at first I thought my feet are numb, but I know they're hitting the ground. And it became something that I've really enjoyed and loved through the years. And I think that obviously has kept me strong, has kept me feeling a lot less depressed, a lot less of the symptoms, even with the switch to Ocrevus, which hasn't been great because of my lifestyle and the exercise and the eating and stuff. I think that makes a big, big difference. Do you agree with that?
I think the evidence that exercise is beneficial in MS is overwhelming. For practical reasons, some people may not be able to go too hard or else they burn themselves out, but
Right.
if you're sensitive to heat and everything, maybe try moderate exercise and build up slowly.
Right, for sure. And I often tell my clients that before we start, like, what is it like in the house right now? If we're doing on Zoom, do you have a window open? If you're in California, do you have it closed? If you're in Michigan, but know your surroundings, know where your stuff is first before we get started. So there's not that frazzled feeling, of like, I don't have this together. And then everything gets nuts. So definitely one of the things. So moving on, the next thing I have, anything that you want to add about the boosters that you see on the, I did want to ask you a question. You did quote something on one of your videos about you seeing COVID gone in the next few months.
Oh boy, I can make myself look like a fool. I think in the short run, COVID is going down. I happen to be in a clinic that's very close to the COVID testing line. And 6 weeks ago, it was a 4-hour line. And it wasn't a bunch of anxious people. It was around a third to actually testing positive for COVID. Now it's a very short line. And, we still certainly have some people in the hospital, but it's declining because it takes some time for people to recover. But in terms of new diagnoses, it's way down. And, hopefully so many people got vaccinated or just got COVID that there's a decent amount of immunity.
So, yes.
Now, can I predict future viral mutations? I mean, I think it's impossible, but hopefully, at least in the short run, we won't have a lot of COVID. And hopefully this was the last big surge, although next winter, no guarantees. We'll see what happens.
Right. For sure. It'll be fun to look forward to. So, like I said, I have enjoyed a lot of your guests and I want to talk to you. We talked a little bit on nutrition and exercise. I do want to talk to you a little bit about, you had a Professor Anthony Feinstein on, who I enjoyed very much. I loved when he talked about depression and anxiety and the difference. You both talked about it being different with an MS patient or a patient that's had an autoimmune disease, but I think at that time you were specifically speaking on MS. And I loved the fact that you both talked about it being like a biological something, somewhere a lesion may be hitting. And so that may cause a different sort of depression. And I could so relate to that. And I think so many of our listeners can, thinking about going to a therapist and trying to explain how I feel. Now, if they don't know anything about multiple sclerosis, they're giving me suggestions that could work, right? I mean, they could work for any person with anxiety, but not really understanding what the anxiety of someone with chronic pain that has a chronic disease. When they don't understand that, it makes us feel like, you know what, just go back to our little spot and be quiet because nobody understands. So I really appreciated you doing that interview with him because I think you both did a great job of explaining the differences in that, and how I think it was with him, he talked about different jobs that you can have that will really kind of cognitively really mess with you after the years. And then, and I could think about that as owning my own gym and being a corporate travel agent where it was, fast, fast, fast. And as the cognitive stuff began to, for me, they were very, very, I would say the beginning, optic neuritis and cognitive stuff that I think I tweeted you that I remember seeing that in high school. And so I'd asked you, do you think that a lot of younger kids get misdiagnosed? Because I remember them thinking I had ADD in like about 11th grade. So I would assume that with depression, anxiety comes along with not picking up on the biological differences that happen with us.
Yeah, people have done some studies on pediatric MS, and there are increased rates of subtle things like poor academic performance prior to any of the focal neurological symptoms like numbness or vision loss. So that's definitely a real thing.
Right. Yeah, I found that to be now. What are you finding as far as with Dr. Feinstein? You talked about the depression and stuff and the anxiety. So are you finding more since COVID has happened and all of these things, more of your patients being depressed or the anxiety is higher? Which one of the two exciting things?
Well, probably more of the anxiety, but I've definitely seen both. COVID has been hard on people in a lot of different ways.
Yes.
I guess the good news is that even though there may be like a sort of neurological basis of depression and anxiety in people with MS, there still is good evidence that the treatments work the same, that, counseling and medication and, lifestyle interventions, sunlight exposure, exercise, diet, that can also help. So the treatment is just as effective, even if the cause may be different.
Right. Agree completely. So I do appreciate that. And then the other person you had on was, okay, I'm going to say his name, Professor George Jelinek. Is that right?
Yeah,
Jelinek.
I think so.
So I have his book. So if I'm not mistaken, this was probably the one for me that comes the closest to where I am as far as dieting. And the big thing is going to be, I'm not kidding, is giving up chicken and giving up cheese. I can give up all dairy, don't care about ice cream, don't do milk. Gluten is like, I leave a little bit of that out, mostly because the rheumatoid, to be honest. But I believe that this to me makes the most sense. This one that he had. And so I would definitely say pick this up if you've not. I think it's a great, so this is the one that's a little more understanding for us lay people, that the first book, from what I understand, was pretty detailed and more for somebody that could really sit down and unpack that. This is going to be, this just came today.
Yeah, the first book, Overcoming Multiple Sclerosis, which is very good. I mean, it has 50 pages of citations, but if you really want to go into the detail of the scientific evidence, that's a good one to get. For that book, the Overcoming Multiple Sclerosis Handbook, it has some scientific information, but also tells stories and give commentary. I wrote chapter 1 of that book, as it turns out, which is just sort of an introduction to MS in general.
Yeah.
I wouldn't say there's one diet that has definitive evidence in MS.
Right.
My general view of nutrition is you don't really need class 1 randomized trials to tell people to eat broccoli. It's reasonable to give people advice sort of based on best available evidence.
Yeah.
First, so with dairy, what I could tell you is that, the risk of MS seems to be higher in countries where people consume more dairy and saturated fat. I actually saw a study that was published just recently from Iran that found that if you look at people with MS and you look at people without MS, there's a little bit more dairy consumption. Not a huge difference in the people who have MS. There's some theoretical reasons this could be the case. For example, one of the milk proteins, butyrolin, has a molecular resemblance to one of the myelin proteins, MOG, myelin oligodendrocyte glycoprotein. And so there's a thought that it may induce some immune activity against myelin.
Right.
But this is not definitive evidence. Professor Jelinek, he has some observational studies suggesting maybe people with MS who avoid dairy do a little bit better on average.
Right.
It's definitely not definitive, but I think it's reasonable to avoid dairy personally.
Right. For sure. And I can't say as much as I would like to say, that there's no difference. I definitely feel when I've eaten, when I've been with the kids or something, I've had ice cream. I'm like, okay, that was not okay. So I think that what I always tell like my clients is let's take this out for a while and nothing else, just take this out and let's see how we do. And that's how I've had to do it with them. When I say, if I were to say, take it all out right now, they'd be like, you're fired. I'm done. I'm not doing this. So I usually do one at a time. That's typically how I've had to do it with them. But so I want to go on to you and your book. So tell us, if no one has read your book, what is the name of your book, sir?
So my book is Resilience in the Face of Multiple Sclerosis. I was inspired to write it just by my own patients. And I just met people who had a lot of problems, but they lived incredible lives. They may have had significant disability from MS, but they were able to be happy and have good relationships with people and be very productive. If you're watching on YouTube, I'm holding up the book. So I interviewed some of my patients, 5 of my patients, just to learn their stories. And then I also include some evidence-based, information about how to build resilience, such as through meditation. And I give the book away for free. If you want a copy, just ask me on Twitter. There's a pinned tweet and just say you want the book and I'll send you a copy.
I did that and you did that. So I appreciate that. Thank you. So I did say that I got on Twitter to find you, but I find myself, my husband is like not another thing she's into, but I'm in the deep, dark Twitter feed now. I'm just like, ooh, look at this and this information. So I do like it because I feel like I'm able to get off, my gym owning days, there was Instagram. And I'm so tired of that. So it's been nice to get into, have some great conversations with some doctors and some intellectual conversations instead of, some ridiculous things on Instagram. So I am enjoying. So thank you for pushing me to Twitter.
Yeah, Twitter is great. You'll learn a lot.
It really is. I give it a thumbs up. So so I want to talk about another thing too, is shift. What is your experience with the use of Botox for spasticity?
So I do Botox mostly not for MS, mostly for migraine or hemifacial spasm or torticollis. Botox is a poison, botulinum toxin. There are a lot of different products. One of them is brand name Botox, which is actually what I usually use just because it's the formulary agent in my institution. Sometimes it could be used for like spasticity, increased tone, either in MS or after a stroke. And, it can be very effective, at decreasing pain or increasing like flexibility. There's not necessarily like a huge gain in function, but often in terms of improving those other things, it can be helpful. Some of my patients do bladder Botox, which can actually help a lot. I'm not qualified to do that, but we have some urologists who can do that.
I'm looking into that actually right now.
Oh, really? Yeah. A lot of people do report success with that.
Yeah. Yeah, I'm interested. So for the migraines, so a lot of our MS patients, a lot of the people that migraines is a big thing. I have terrible migraines. So that's something that you do as well. You do the Botox for the migraines.
That is something I do. That's kind of the original FDA indication. A lot of Botox use is off-label. And that was discovered accidentally when people getting cosmetic Botox were reporting reduced migraines. My uncle happens to be an older plastic surgeon, and he told me I knew Botox worked for migraines for like 30 years.
Wow.
And sure enough, they did a clinical trial and it was successful.
Yeah, I remember being years ago having one of my parents' friends were using it as this, it was long time ago. So it wasn't great, but his whole forehead was super shiny. And I was like, can someone explain to me? I was probably 5. What is happening with his head? But it was then, and they used it then. I didn't really understand it. It didn't look so great then, but I'm sure it looks much better now. So, all right, Doctor, I'm going to get to you. I'm going to tease you a little bit. So as I was reading your bio, I saw one of your hobbies, circus arts. I was confused. I don't know what that is. So for my own entertainment, please explain. I did not Google it. I want you to explain to me. Are you a clown?
I'm not a professional or anything, but as a hobby, I do juggling and I can ride a unicycle. Not as much anymore, but I can show you a little bit. We're on a podcast.
Yeah, definitely show me. My son rides a unicycle. So I can't, fancy. Look at you. Woo! Nice job.
Just to see a little bit there.
Can you do the one-handed?
What was that?
Can you juggle one-handed?
Sure. Yeah, a little bit.
Okay. Good. I like it. Yeah. My son is, they used to make fun. My youngest rides a unicycle and he's 6'3". So as you can imagine, it's pretty funny to see the 6'3" kid on a unicycle, but he learned years ago. And so he's just very balanced and so I find it to be fascinating that was his choice of sports to do. So, but but I wanted to know that. I thought that was very interesting. I'm like, wait, what? What is it? What is this? So that's awesome. I love that you do that. Could be very good to kind of get your mind off things too, right?
Yeah, I haven't done it as much recently, to be honest, just been busy, but it is a lot of fun for sure.
Yeah. So coming to an end, what do you see moving forward with the MS journey? And not just that, but neurologically, all of this stuff moving forward past all the COVID stuff, past the pandemic. How do you see all of the pandemic stuff changing in the ability for the neurologist and the patients to work together in a better way, because we have so much more open communication in some Instagram, but mostly in our new Twitter, but we are able to talk so much more via social media?
Yeah, I think it's much easier for someone to learn about things. You can imagine like 40 years ago, you'd have to go to a medical library and check out books,
Right.
virtually impossible for a layperson.
Right.
But now, it's easy to look things up. And hey, don't be intimidated by the fine print.
Yeah.
You can look up the drug product label and just read all the side effects and look at all the studies.
Right.
Literally just type into Google the drug and product label.
Right.
You can find a lot of information from that. And from experts, I mean, obviously you got to be careful and make sure don't put too much faith in any one
Right.
person, but
Sure.
it's just a lot
Absolutely.
easier to get information. I think that some things will never be 100% normal. We'll use probably
Right.
virtual visits more just for convenience.
I hope so.
I mean, it's good for certain things.
Yeah.
It's certainly great for like epilepsy, for instance.
Right.
For certain things, you need to do an exam and everything. You can't replace everything with video.
Sure. Absolutely.
But I think it has a lot of utility. I know Dr. Boster has done some second opinions where he reviews MRI scans and people who are in even a different state, for example, or really far away. So it gives people more access to their healthcare provider.
Right. Now, what would you say as far as that we're on this subject, as far as I noticed through COVID, a lot of patients were seeing things, learning things, and thinking like, my neurologist has never even brought this to my attention. I've never even discussed this with my neurologist. When it comes time, and I think unfortunately it does happen, where there needs to be an end sometimes with your neurologist, what would you say to a patient that would be a red light when you're going to a neurologist and you're newly diagnosed? I do a lot of that, of those discussions with newly diagnosed patients, things that I see as red lights. What would you say, looking at it on your end, would be a red light?
Well, in terms of like newly diagnosed people, even if you like your neurologist and you don't see any red flags, I mean, it's certainly reasonable to get a second opinion, just because, one, the diagnosis of MS can be difficult and there is a decent amount of misdiagnosis. And also, there's evidence that the treatments are kind of most effective early on in the disease. We really have changed the course of the disease, especially for younger people with relapsing MS. I may not look that old, but I definitely remember the time when we admitted a lot of people to the hospital for plasmapheresis because they had a bad relapse that didn't get better with steroids. We really cut down on that a lot. So those early decisions, I mean, you could get a second opinion almost no matter what. In terms of like later on, obviously, if you don't feel that you're being listened to, or you feel like your doctor is trying to push you into a treatment that you're not comfortable with, I mean, the reality is these medications can have side effects. And during COVID-19, we've definitely been burned multiple times. I would say 80% of the complications I had in the last few years from these immunosuppressants, were COVID. And so we definitely have to be a little bit more cautious. And also, sometimes doctors tend to focus on like disease modifying therapy and MRI machines and sort of long-term things, but you may care more about your day-to-day symptoms, pain, and fatigue. So it's reasonable to get a second opinion just for that if it's not being addressed, even if you're kind of stable, so to speak.
Right. No, I appreciate that. And I even think, when we had talked before and I had said that I'd gone through different stages and then becoming JC positive and everything that went bonkers with COVID, and wasn't able to really connect with my neurologist. And when I did at the time, there really wasn't an answer. It was kind of more like, well, what do you think? And I kept thinking, are we serious? Well, let me go research in my bag and see what my neurology bag says, which one would be the best. And so that brought me on a search and come to the end of it. And I just think for patients sometimes, and I think you'll understand what I'm saying, I just went back to him after all was said and done. I said, I don't want to leave. And I've been here for, a long time. Help me understand, how can we work together so that I can hear you? And then he just talked to me and he just said, I haven't been the best at communicating with you, and let's sit down and start over. So I think sometimes we can make a decision quick without, and as you well know, with our emotional stuff that comes with multiple sclerosis or any of the diseases. I think, taking a step back and sitting with your neurologist and saying, can we talk? I'm not feeling this. I need this, and making it, because you got to have that relationship, right?
Yeah. And I personally, I wouldn't take offense if someone wanted to see someone else. Sometimes you feel more comfortable with a certain doctor, or you just want a second opinion, and there's nothing wrong with that.
Right. Absolutely. Well, I thank you for that, Dr. Bieber. I think that sheds like a great light for so many of our patients that really still to this day, it always amazes me, even the ones that have had it for so long and are still unsure about so many things. And I really appreciate what you do for the MS world and really putting the videos out and giving us some fun and also a lot of information. It's really been a huge blessing for me, and really I've enjoyed it. And thank you for getting me on Twitter, and so I really do enjoy it, and I look forward to working with you again, and looking forward to seeing how this Epstein-Barr and how this works as we're on phase 1. So.
Yeah,
Thank you.
Look forward to that research as well. And thanks for the kind words. I have a lot of fun making the videos, but it's always good to get some positive feedback.
Oh, for sure. Well, Dr. Bieber, you do so much for us, and we're so grateful to have you. Thank you so much for being on my program today, and hope that you have a great rest of your day, and look forward to seeing you again. So with that, everybody have a great day, and thank you, Dr. Bieber, for being with us. I'll go ahead and stop the recording. Hold on. Well, thank you so much for joining us today on Move It or Lose It podcast, where you can again find us every Tuesday, and also wherever you like your podcasts, whether it's Apple, Spotify, Stitcher. Join us on that, and we can't wait to see you again. We're going to have a lot of exciting guests and working together. And as always, you'll hear us say at the end of every podcast, we are stronger together. So let's do it. Let's become stronger together.